I think you bring up a really important point about being engaged with your friends and family. I think sometimes when we get sort of stuck into this vortex of the hospital, it's work, eat, sleep, and repeat again. And I think, you know, for a lot of people, you do lose sight of the important relationships that you have with your friends, your family, your spouse, your children. You know, can you talk, you know, to that, whether it's your own experience or your friend's experience, about how to balance that?
Well, I mean, I suppose I was always very aware that I really enjoyed my life. Like, I really liked travelling. I wanted to write books, and I didn't feel guilty about that. Well, I suppose I did feel a bit guilty. You always feel guilty as a doctor. You're always guilty. You're not studying enough, you're not working enough, you know, whatever. But I sort of had this idea in my head that I wanted to do general practice because I knew that that would make me the happiest. And when I have medical students now, through my work as a GP, I always say to them, you know your pharmacology and your physiology and your anatomy, you're in fourth year or whatever, like, you know all those things. Clinically, you can auscultate a set of lungs or whatever. But my advice to you is always ask yourself now what it is you think you want out of your life. And if it's to spend 15 hours a day in an operating theatre for the next 35 years, and some people really enjoy that, that's fantastic. But if it is, I maybe want to travel a bit, I maybe want to have a family, or I maybe want to write books, or I don't know, I enjoy acting, or I'm pretty into triathlons, and I actually like seeing my friends and family, then you need to sort of, I think there's this thing in medicine where we're told your job comes first and everything else comes second. I offer the converse to that. You and your life comes first and your job comes second. Even something as important and as essential as being, it's a great word to use in the Times, essential.
Essential workers we are.
Yes, the frontliners, as being a doctor. It's like when they say happy mother, happy baby, also happy father, happy baby. I mean, you know, it's this idea of happy doctor, happy patient. You cannot be an effective doctor if you yourself are not satisfied or happy or at peace with yourself. And that is, I think, why, like we were saying, you need things like supportive family, supportive friends, honesty, good GPs, and also don't have fear if something bad happens at work to call whoever you're insured with. Yes, we're doing this for Avant, but that's actually very, very important, because there's nothing worse than going home feeling like I've just done something really bad and I don't know who to tell about it. You know, there are those options. And I didn't really know well enough when I was an intern that I had all of those options.
Yeah, and look, I mean, we hear too often about, you know, physician and doctor burnout, and I think it's something that you're very passionate, given just the constant demands on our time, and there's just not enough hours in the day sometimes to get all the jobs done. I mean, what things do you do now, or, you know, thinking back, that help maintain your sanity?
Well, I used to write. That helped. I travelled a lot. You know, I have a terrible shopping habit. My housemate actually cleaned my room when I was in Western Australia because he was having someone stay and it was so disgracefully messy. And he was like, you know, you have about 20 pairs of tan sandals. And I was sort of like, yeah, that must have been the stress. I just keep buying the same coloured pair of sandals. No, I'm very open with my parents. But look, honestly, the only people, unfortunately, who understand what you're going through are going to be your fellow interns, which is hard to say because everyone wants to support you if you're close to them, your spouse or your partner or whatever. But no one really gets it like the people who are doing the same things as you. That's why it's so important to be kind to your colleagues and to accept kindness in return. It sounds really trite, but it actually isn't. Like, I'm part of a group called Gathering of Kindness in Medicine, and I gave a talk at St Vincent's Hospital in Melbourne last year. And I was like, obviously I'm not the only person who's recognised this. There's this sense of we're really hard on ourselves and each other. And if you cannot talk, you can go home and talk to your boyfriend or your girlfriend about your day, but if they're not a doctor or they're not an intern, they don't quite grasp, I think, exactly what's happening, whereas my friends really inherently did.